Thank you very much, Madam Speaker. And I want to recognize that I'm speaking to you from the House of Commons here in Ottawa, which is on unceded Algonquin territory. We're speaking today, obviously, upon a bill that is extremely important for those of us in this House, but also for the Canadians that are listening to this debate and the Canadians that are feeling the pressures of affordability right now. Bill C-31 will address two key facets of affordability in this country in terms of housing and in terms of dental care. Madam Speaker, I guess the first thing I want to broach is sort of why we are targeting these two particular areas. It doesn't matter which riding you represent in this chamber. It doesn't matter which part of the country you come from. Canadians are feeling the same sentiment, and that is a sentiment about the cost of living, that prices are escalating and that life has become simply too expensive. This is partly a function of the fact of the pandemic, is partly a function of the fact of global conflicts, such as Russia's unjust invasion of Ukraine, partly a function of the fact of supply chains and the need to make them more resilient. And what we are doing as a government is trying to hear those concerns and respond directly to those concerns. Last week, we provided a doubling of the GST rebate, something that I believe all parties in this chamber supported, for which I'm thankful, for which I believe Canadians are thankful. Today, what we are talking about is, again, targeted relief on two indicia, the housing indicia and the issue of extended health care to include dental health. Madam Speaker, this bill will do two pivotal things. In terms of the housing benefit, what it proposes to do is provide a top-up payment to something that is called the Canada Housing Benefit. And it's a $1.2 billion investment that will result in a $500 benefit being made available to approximately 1.8 million people in this country who rent, including people who are students or people who are struggling with the cost of rental housing. The second key facet of the bill, Madam Speaker, as you've heard in the debate thus far today, is that it will propose to provide dental care for uninsured Canadians with a family income of less than $90,000 annually, and target that dental relief to children under the age of 12. Now, Madam Speaker, I think it's important to sort of recap for Canadians sort of where we are in terms of this fight to build a more affordable Canada and to ease issues that relate to the cost of living. In terms of what we've been doing on the housing front, Madam Speaker, since I've been elected to this place in 2015, about 2 years into our first mandate as a government, we launched a national housing strategy. The time it was launched, it was approximately $40 billion deep. That housing strategy has expanded to be something to the tune of $72 billion now, which included a $14 billion investment in housing just in the 2022 budget. Key to for the purposes of this debate is that what we're doing with the National Housing Strategy involves the Canada Housing Benefit, which is a $4 billion program within that broader strategy, which targets an average of $2,500 in direct assistance to assist those who are low income with the cost of rent and the high cost of rent that they're facing. There are other aspects of what we've been doing with respect to affordability, Madam Speaker. We can talk about the Canada Workers Benefit. We can talk about something that I'm very proud of, which is the Canada Child Benefit, which is a means-tested, non-taxable benefit that is directed directly to those families that need the assistance the most. With respect to childcare, we can talk about what we've done just in the past 12 months with respect to alleviating the costs of childcare for people raising a young family around this country, reducing those costs by 50% by the end of this year and to $10 a day by the end of 4 years. What we've done is taken significant steps, and what I found troubling, Madam Speaker, in my time in this chamber as a parliamentarian is the consistent opposition we've faced, particularly from His Majesty's official opposition on many of the programs that I just outlined. I was very pleased to see support for the GST doubling of that rebate as recently as last week, but I'm still troubled by the fact that an initiative such as the one that we're talking about today, which is again targeted relief for those that need it the most to assist with some of their most basic necessities, such as housing and extended health care, are being opposed by some of the members opposite. And what I would do is urge them through the course of their deliberations on this bill to change their position in terms of their vote. And what I would say to you, Madam Speaker, in terms of housing, I want to dwell a bit upon housing and dental care as specific topics. We know that housing has been expensive and has gotten more expensive in this country in recent times. At the end of September of 2022, the average rent for property types across the country saw a monthly increase of 4.3%, an annual increase of 15%, and a 21% increase since the market low, which was experienced in April of 2021. My city of Toronto consistently ranks amongst one of the most expensive rental markets in the country, somewhat neck and neck with Vancouver. What we know, Madam Speaker, is that this has become a challenge for the constituents that I represent, a challenge for people throughout Toronto, a challenge for people in Vancouver, and a challenge for people right across the country. It's something I'm reminded of by the constituents I represent and by the stakeholders in my community. I want to highlight a couple of key stakeholders because they've been doing consistent work in the area of affordable housing for many, many years. One is the Parkdale Neighbourhood Land Trust that have taken it upon themselves to both index the amount of rooming houses that are available as deeply affordable housing in the community of Parkdale. But secondly, through their Land Trust initiative, they've collaborated with city partners and provincial partners to actually purchase land and keep rooming houses viable in the city of Toronto, in my community, and keep people who need supportive housing, who need deeply affordable housing, properly housed. It's a tremendous initiative, and they do that in conjunction with the Parkdale Activity Recreation Centre, which manages the property that they were able to purchase in 2019. That is a program I want to highlight. Another program I want to highlight in terms of housing is what we've been able to do very successfully as part of that national housing strategy with the Rapid Housing Initiative. Madam Speaker, this is an initiative that started out with about $500 million for urban cities, $200 million of which was dedicated to Toronto, and it was subsequently doubled in budget 2021 because of the popularity of this program, because it provides acute, targeted assistance to those that need it the most, and it does it quickly, as the name befits. So within 12 months, people are housed very, very quickly. What the new totals mean for the Rapid Housing Initiative as part of this broader suite of housing assistance that we're providing is that my city of Toronto will be receiving $440 million to create more than 1,000 new homes and to create them very quickly. How does this impact Canadians? Well, it impacts my constituents. We have $14 million of that money coming directly into Parkdale, assisting with the creation of about 50 modular units on Dunn Avenue, and that's sort of a housing policy that takes root and takes hold and starts to work and work quickly. This bill will help in the same vein, Madam Speaker. Bill C-31 will provide an additional benefit for those who already receive the Canada Housing Benefit. And when I say targeted and means tested, I think the facts are important to articulate in this chamber. We're talking about a one-time benefit that will go to applicants with incomes of less than $35,000 if they are a family, or less than $20,000 as individuals. Certainly, every member in this House can agree with the idea that for people in those low-income brackets, they deserve our help the most, and they deserve targeted support on behalf of the Parliament of Canada. Madam Speaker, I want to turn next in these last remaining couple of minutes to the dental idea. And we know that dental care is part and parcel of healthcare as we conceive of it in this country. You heard my intervention with respect to the previous speaker. We've heard from entities like the Canadian Association of Public Health Dentistry that talk about people who don't receive the dental care they need because of the costs associated with it. That in fact, 55% of dental care right now is delivered by those who have private insurance. 40% of Canadians pay out of pocket for their dental care, and some just don't access it because they simply can't afford to. What that does is it creates a knock-on impact on our healthcare system. So people who don't receive that primary healthcare that they need preemptively to prevent problems from mushrooming end up in our emergency rooms, in our hospitals, which are publicly funded, and that has a knock-on cost for our healthcare system. Let's avoid that cost by providing something as simple as basic dental care for people that need it the most. And I would dare say, Madam Speaker, that it's hard to argue with the needs of children in terms of their growth and their development, addressing their extended healthcare needs by providing something as basic visits to the dentist that would be provided free of charge. That's something that's important to do. That's something that we're trying to do through this legislation. Madam Speaker, I think targeting housing, targeting extended healthcare benefits through the lens of dental care is something critical to dealing with affordability as those challenges are being faced by Canadians right now. That's why I'm acting in support of this bill, and I urge my colleagues to do the same. Merci beaucoup.
Gentleman for Battle River Crowfoot.
Thank